Healthcare reform
Say,
has been a lot to swallow, and with all the possible changes citizens could face, Senator Dan Newberry wants you to have choices and says that's what's behind a state question.
By making a constitutional amendment that basically says you cannot tax, fine, or impact another otherwise for not buying health insurance, and protecting doctors' ability to accept funds that are not through the insurance system, we feel like we're protecting the rights of Oklahomans.
If passed, the question would prohibit making a person or employer participate in a health care system. But Senator Tom Adelson says we're already practicing a health care system that pays for everyone.
To me, the real question is, why should people be free to use health care and then not pay for it? In Oklahoma, the cost of uncompensated care increases the cost of family health coverage, family of four, by $2,911.
It's one reason Adelson says a fix is necessary. He believes the federal systems we have already in place are working, and healthcare reform would only add to that.
We do have the Canadian system in the United States today. We've had it for 50 years. It's called Medicare, and it works pretty well.
While Newberry agrees that improvements can be made to the system, he says mandating something is going too far.
I don't believe that the federal government should, and I don't believe we as a state should, require people to purchase an item.
So can state law overrule federal law? Reading through the state question, it even says the measure cannot affect or negate all federal laws or rules. But Newberry says that's up for debate.
The federal government only has the rights to do what the states allow them to do. So we have to give them the power to execute authority over certain areas.
But Adelson calls that argument absurd, saying there's nothing in the Constitution that specifically says Congress has the authority to enact Social Security, Medicare, or Medicaid funding. But all the while, those programs are in place across the country. Plus, he says providing health care is the right thing to do.
It's a humanitarian thing to do. People who are sick, primarily children, are not able, and people between the ages of 19 and 64, are not getting the coverage that they need.
here we go.
It's a debate that will continue at the ballot box. Marla Carter, 2 News Works for you.